Welcome to this explainer from MediByte. Today, we're breaking down everything you need to know about typhoid fever. It's a really serious bacterial infection, and it's a huge health concern for millions of people around the globe, especially if you're a traveler.
Okay, so let's start with a question I think a lot of us have before a big trip. You pack your bags, you've got your passport ready, but are you really prepared for the health risks that can pop up when you're exploring new and exciting places?
Well, one of the biggest risks out there, especially in areas with, let's say, less than perfect sanitation, is typhoid fever. So, what exactly is it?
So, at its very core, typhoid is a bacterial infection. The specific troublemaker is a type of salmonella called Salmonella Typhi. And get this, it's only found in humans. Now, this isn't like the salmonella that might give you a nasty case of food poisoning. This one causes a much more severe, whole-body kind of illness. And the sheer scale of this problem is, well, it's staggering. We're talking about an estimated 9.2 million cases across the globe every single year. And that leads to over 110,000 deaths, mostly in places like Southeast Asia, Africa, and the Eastern Mediterranean. It's a huge deal.
So, how does this one little bacteria cause so many infections? Well, understanding its path, how it gets from one person to another, is absolutely key to stopping it.
And here's where it gets really tricky. Some people can actually spread the disease without ever feeling sick themselves. You see, after they recover, a small number of people become what we call chronic carriers. They feel totally fine, but they continue to shed the bacteria, sometimes for the rest of their lives. The most famous, or maybe I should say infamous, example of this is the story of Typhoid Mary. Mary Mallon was a cook in New York back in the early 20th century. As an asymptomatic carrier, she had no idea she was sick. She unknowingly infected dozens and dozens of people as she moved from one cooking job to another, causing multiple outbreaks and becoming this legendary cautionary tale in public health. So the infection spreads through a pretty clear cycle. It all starts when the bacteria from an infected person's waste gets into a water supply or onto food. This usually happens because of poor sanitation or just not washing hands properly. Then, when someone else eats that contaminated food or drinks that water, the bacteria get into their system, spread into their bloodstream, and boom, the whole illness starts all over again.
Okay, so if someone does get infected, what are the signs to look out for? Now, unlike a sudden stomach bug that hits you like a truck, the symptoms of typhoid are sneakier. They tend to develop gradually, often over several weeks.
This timeline really lays out the typical progression. That first week might just feel like the flu, a bit of a fever, a headache, but by week 2, that fever can spike dangerously high, and some people get this characteristic rash of flat rose-colored spots. Now, if it's left untreated, week 3 is when things can get really serious, with life-threatening complications like intestinal bleeding. It's usually not until the 4th week that the fever starts to break and recovery can finally begin.
The good news is, modern medicine has some really effective ways to both identify and fight this infection. But getting that proper diagnosis is the first critical step. To confirm it's typhoid, doctors can't just rely on symptoms alone. They need to actually find the bacteria. So they'll take samples, blood, stool, or urine, and send them off to a lab. There, the technicians try to grow or culture the bacteria from the sample. And if they can, that's the definitive proof of a typhoid infection. Once it's diagnosed, our main weapon against typhoid is a course of antibiotics, like ceftriaxone or azithromycin. For really severe infections, doctors might also add in corticosteroids to help reduce inflammation, especially if the patient is in shock or becoming delirious. And the impact of treatment is just undeniable. Look at this. Without antibiotics, the fatality rate can be as high as 15%. But with proper medical care, that number plummets to just 1%. That is a powerful testament to modern medicine right there.
So, the big question, how can we avoid getting infected in the first place? When it comes to typhoid, believe me, an ounce of prevention is absolutely worth a pound of cure.
This is all about being super cautious with what you eat and drink, especially in areas where typhoid is common. You want to stick to food that's cooked all the way through and served piping hot. Drink only sealed, bottled water, and definitely avoid ice unless you know for sure it was made from purified water. A really simple rule to remember is boil it, cook it, peel it, or forget it. Of course, vaccination is another powerful tool in our toolbox. There's both an oral vaccine, which you take as a series of capsules, and a good old-fashioned injectable one. They offer about 50 to 80% protection, and they are highly recommended if you're traveling to a high-risk region or if you know you're going to be in close contact with a known carrier. And this all brings us to a final pretty critical question. With antibiotic resistance becoming a bigger and bigger problem worldwide, prevention through good sanitation, hygiene, and vaccination is more important than ever. The key takeaway here is that our best strategy is always to stop the infection before it even starts. If you found this explainer helpful, please do us a favor and like and share it, and be sure to subscribe to MediByte for more insights like this. Thanks for watching!